I put all my patients on a very comprehensive vitamin and mineral amino acid and essential fatty acid blend. What we know is that 70% of the general population is deficient in magnesium. 70%. So the fibromyalgia patients, they're all deficient in magnesium. What does magnesium do? Well, it's in 300 different bodily processes. So it controls things like it helps be able to take amino acids and turn them into brain chemicals like serotonin and dopamine. It also is part of the Krebs cycle and ATP, and there's all these wonderful things. But it's also a natural muscle relaxer. So magnesium is a natural muscle relaxer. So if you have a patient that's suffering from constipation, I would encourage you, instead of putting them on fiber, to start thinking about maybe they have a magnesium deficiency. And typically you'll find that once you get them up above 500 milligrams, I think the RDA is 300 or 400. My fibromyalgia, the formula that I have for my fibromyalgia patients is 700 milligrams. Now if you take too much magnesium, you poop all day, right? Poop, 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 right? Of course, for some people that's a good thing, because many people that you interact with, your patients, will say, you know, I use the, you ask them, do you have normal bowel movements? Oh yeah, yeah. How often do you have a bowel movement? You know, once a week. You start getting their magnesium level up, not only do you get them their bowel movements normal, you know, they'll come back to you and say, Dr. Murphree, my bowel movements something's the matter. Well, tell me about that, Miss Jones. Well, every time I eat, I poop. That's how we're supposed to be, right? That's great. That's good. That's not bad. That's good. So magnesium not only helps with muscle tightness, but also relaxes the colon. Malic acid. Malic acid is part of the Krebs cycle, so it increases energy, but it also helps to expel lactic acid, which is a buildup of waste product that gets in the muscle tissue. So lactic acid is very helpful for these folks. The formula kind of that I use, and it's probably similar to the vitamins you use, are based on the optimal daily allowance. The optimal daily allowance is some 500 to 1,000 times stronger than the recommended disease allowance, or the RDA. You have to use high doses. If you don't, you won't notice any difference with these folks. So I use B5. I think my formula has 400 or 500 milligrams of B5, pantothenic acid. Why is pantothenic acid so important? Because it recycles adrenal hormones, cortisol, DHEA, and other things. It helps. It's the stress vitamin. I think the RDA is what, 20 milligrams? You're not going to get anywhere with that. 2 grams of vitamin C. But anyway, all these formulas are in my books. What I want to share with you is this. You've got to use high doses. You don't have to use it intravenous, because what I have found is that my patients do just as well without the IV therapy now, using the formulas, the high doses of vitamins and minerals, as they did before. And what happened before is we created these junkies that had to come in every week and sit there for an hour and a half and get an IV therapy. It's expensive. And I know there's integrated medical doctors who are listening to this program now, and they're doing that, using Myers cocktail. And that's fine. I mean, if you want to do that, that's fine. What I want to make sure that non-allopathic doctors know is that you can help these people and not use any prescription medication. None. I don't use any in my practice. Now, push comes to shove, you want to have an allopathic physician you've got a good relationship with, so that when you strike out, when you've done everything I share with you in the manuals and other things and talks in my 2-day seminar, and you can't get them to sleep, then you've got to get them to sleep using Elavil or Trazodone or Ambien. They've got to sleep. So there's a time and a place. But for non-allopathic doctors, don't feel like you're at a disadvantage because you can't use prescription medications with these tough cases. The people who come to see me are not easy. And they're very hard. They drive or fly in from all over. I don't say that to make it sound like I'm some great doctor. I say that because they've been everywhere and tried everything else. So they're going to wait to come see me last. They're going to see people at Mayo. They're going to see people at Johns Hopkins before they come see a little chiropractor. but they come back because they get well, and you can do the very same thing. So that's my pep talk for you non-allopathic doctors out there. Well, why is the vitamin mineral so important? Well, for several reasons that we don't have time to go into. But what I would like to share with you is one thing: essential fatty acids, omega-3s, omega-6s. What we know about that is that we have prostaglandins, or hormones. So prostaglandin 1, prostaglandin 2, prostaglandin 3. And prostaglandin 1 and 3 are the good guys. They reduce inflammation. They're our natural anti-inflammatory hormones. Prostaglandin 2 is the bad guy. It causes inflammation. Now, in the old days, and now we're back to the old days, right? You'll get what I'm saying here in just a minute. Is in the old days, the non-steroidal anti-inflammatories did what? They came along and they blocked that and that and that. So they nullified, they wiped out all three of these. Now, Pfizer came along and came out with something called Celebrex, which was a COX-2 inhibitor. So it left these good guys alone, but it just worked here. And the whole thing about the COX-2 inhibitors were they were supposed to be safer. That hadn't proved to be true, right? In fact, they were never shown in studies to be safer than the older non-steroidal anti-inflammatories. 10 to 20,000 people die every year from non-steroidal anti-inflammatories. 10 to 20,000 people. 200,000 people admitted to the hospital every year with bleeding, perforated stomachs from taking non-steroidal anti-inflammatories, including those who were taking COX-2 inhibitors. So it was never shown that COX-2 inhibitors were any better. What makes more sense to me than trying to do it this way is to use biochemistry that most of us learned and forgot. Well, what revs up and what creates prostaglandin 1, the good guy, the anti-inflammatory? Omega-3. Omega-3, which you get from fish oils, flaxseed, that revs up prostaglandin 1 and prostaglandin 3. So that's why fish oil is a really potent anti-inflammatory. It's why you're seeing it showing up more, not only to treat autoimmune diseases, rheumatoid, Sjogren's, Reiter's. I use very high doses when I treat those people, get good results. But you're also seeing it's all over the place now with heart disease and inflammation. And in my blatant self-promotion here, heart book, all about what we're not being told about heart disease is, by the way, cholesterol is not the culprit. It's free radical damage and inflammation. And what we're finding out is the way to reduce that free radical and inflammation, the most potent thing and healthiest thing you and your patients can do is to take high doses of fish oil.